what kind of challenges would you say that your companies are facing at the moment?
I think if we take the pandemic on the side, where it was a lot of problems with supply, even plastics couldn't be bought, I think the challenges haven't changed. It's access to test environments in the healthcare setting, I still think is a big challenge for the industry as a whole, and especially for small companies. Capital is a challenge, and access to the right competence is a challenge. And I think the last part is what we try to solve with these two initiatives.
Do you agree?
Yes, I agree. The access to competence and building the competence organically within the startup companies is so crucial today. But also bringing all the different disciplines into a project. So we can't do things alone anymore. We've realized that. That's also like a lesson from the pandemic, right? So cross between scientific areas, but also between different types of organizations like big companies, small companies, academia and society. So the triple helix, the Swedish triple helix, which we're famous for.
Which is, I think, further complicated by the fact that the products of tomorrow will not be medicines in isolation. It will be a combination of sensor technology with communication technology and medicines. So we are about to redefine the meaning of innovation in a way. It goes beyond the API or the pharmaceutical ingredient itself, which means that we need to find new ways of collaborating, because when you mix these different industry verticals into the same ecosystem, the business logics are different in these different industry sectors. So we need to be not only focusing on what to innovate, but also to a greater extent asking ourselves how to invent. And I think that is where these two environments bring new ideas into the how dimension, basically.
If you could just make a wish of what would happen in the nearest future, like nearest 1 or 2 years, what do you see? What could solve your company's problem or the scientist's problem?
I can start with, if we could democratize data and provide access to all the data that we are sitting on, both in industry but foremost in the hospital setting and patient data, that could attract a lot of interesting companies to Sweden. So I think that is what I would put on my number one topic on that list.
What do you mean by democratizing?
I mean, data is one of the biggest assets we have, and we have plenty of it, but it's not accessible in a way that it can be used to fuel innovation. So that could be data from industry, both preclinical and clinical data, but also patient data. And we see some countries who are really in the forefront of making data available, and we see the result it has on their attractiveness as a collaboration nation, as to speak. I mean, Finland has been ahead of us, Israel is doing fantastic stuff, and I think Sweden has a huge potential here if we could get our act together.
And there's like legal issues and...
It's everything from legal to culture to ethical to the fact that we have a lot of different owners of data today. It's not one owner, it's complex.
Do you agree?
I agree with that, but I will also add the closeness that we're trying to achieve now between the academics and the industry. So we, again, have the shared purpose, I think, in life, or with our hubs to bring the academic research closer to the industry partners, and being that closeness being even more integrated, I think, will completely change the way how we treat innovations going from research to market. So that's my wish.
If we could mix your number one and my number one, it would be great. Because I agree with this, because we need to interact with care providers, not with a purpose to launch new products, but with a purpose to co-innovate. And the system is not set up for that type of relationships. It's always a industry supplier perspective, but we need to have a more of a partnering approach to innovation together with academics and healthcare. So that's super important. It depends on day shape what you choose as your number one. Exactly. I would say.
I'm sure there are.
Could you rephrase your wish? I mean, I didn't really get the exact wish what you want.
Okay, so very simply put, let's break down the silos. So that's what I'm after. So there's a silo between the academics and the industry, which we are now trying to overcome. to do that, to continue the trajectory that we are on now, to bring the academics into the industrial environment, but
And vice
also
versa.
and the other way around. So bringing the industry competence into the academics and being much more integrated as organizations, I think will enable us to take innovations much faster to the market.
Who could do that?
So we need to do that together. So both academics, industry, and actors like us that try to facilitate this. And of course, there's a political incitement that needs to be in place as well. So from the politics, really, this is the way to go, is what we need from them. Mm-hmm.
So will you? So do you think this will happen? I mean, it's a wish, but I also wonder, do you believe? Do you believe this can happen? I mean, the data and the collaboration.
I think it has to happen. It's not about believe or not, because if we should be able to maintain the level of healthcare that we have, with the increasing cost and the increasing need for healthcare, we need to do things differently. So it will happen. The question is, will it happen early enough? And will it happen in a way where Sweden lose its footprint as an innovation nation? So should we catch up, or should we follow, or should we lead? And I just hope that we do it quickly enough so we don't become the followers in this.
And I would agree, it needs to happen. If you put another angle to it, life science is one of the base industries of Sweden. It's one of the drivers for Swedish export. So in that sense, if you want to continue that, if you want to stay strong in that area, we need to do this. Yeah. For me, it's a no-brainer, actually. But maybe I'm biased in the question, I don't know.
Very interesting. So this is going to happen. Great. Thank you.
Happen.
Thank you.
Thank you.